Hello, this is our presentation on dementia for nutrition in the life cycle. Hello, this is our In this slide, I will be discussing the background of dementia, which is a progressive decline in cognition, which causes lack of independence and daily activity performance. It also causes confusion, anxiety, agitation, loss of muscle control, impairment of hunger and appetite regulation, chewing and swallowing difficulties, and dental concerns that can all impact nutritional status. And individuals with dementia are more likely to experience weight loss, which are related to some things I mentioned before, like not being able to regulate their appetite, and they also have appetite changes and malnutrition. And they're more susceptible to falls and hospital visits, especially if they are malnourished. And they also have more eating difficulties, such as chewing and swallowing, so they are very susceptible to developing dysphagia. Dementia is best represented as a syndrome that can be caused by several diseases. Dementia can be conceptualized into two broad categories: neurodegenerative, which is irreversible, and non-neurodegenerative, which is reversible. And on this slide, on the left, is where I show examples of a neurodegenerative cause of dementia, which are the frontotemporal lobar degeneration and Alzheimer's disease and Lewy bodies. And on the right side, I have vascular dementia and metabolic causes, which represent the non neurodegenerative causes of dementia. And neurodegeneration is the most common cause of dementia for the elderly population, and that includes the ones on the left that I just mentioned. Alzheimer's disease is the most common neurodegenerative form of dementia, as I briefly discussed in the previous slide. And 5.8 million individuals in the United States have Alzheimer's disease, and 5.6 million individuals of this population includes those 65 years of age and older, and 200,000 of that population includes those under the age of 65 with younger onset Alzheimer's. Frontotemporal dementia, or FTD, is a common cause of early onset dementia, and FTD is also characterized by the degeneration of the frontal lobes of the brain, and the prevalence of this is 2 to 31%. And there are also several variants of FTD. And according to the CDC, it is predicted that by 2060, there will be roughly 14 million people with Alzheimer's disease, and minorities will primarily be affected. And among all races, women are almost 2 times more likely to develop Alzheimer's disease than men. And this is just based on the reasoning that women often live longer. This is a visual that I created to simplify the different stages of dementia. And in stage one, we have memory deterioration begins, unintended weight loss, forgetting to eat, unable to recognize food, and forgetting how to use utensils. And in stage two, this includes deterioration of language and cognition, mood disturbances at mealtimes, which can lead to anorexia, which also correlates to the food refusal, and alteration of taste and smell, which can also lead to a decrease in oral intake, and anxiety of being fed by another person, considering they have a lack of independence. And in stage three, this includes advanced deterioration and of language and cognition. And this is where we see dysphagia happening, which can lead to aspiration, considering they're not able to chew well. And they also have mood disorders that lead to behavior issues, such as removing food from mouth. And I have also read that pocketing mouth is also something common with patients that have dementia. And in stage four, this includes the continuation of language and cognition deterioration, and withdrawal and minimal communication. This is a visual that I created to simplify the different stages of dementia. And in stage one, we have memory deterioration begins, unintended weight loss, forgetting to eat, unable to recognize food, and forgetting how to use utensils. And in stage two, this includes deterioration of language and cognition, mood disturbances at mealtimes, which can lead to anorexia, which also correlates to the food refusal, and alteration of taste and smell, which can also lead to a decrease in oral intake, and anxiety of being fed by another person, considering they have a lack of independence. And in stage three, this includes advanced deterioration and of language and cognition. And this is where we see dysphagia happening, which can lead to aspiration, considering they're not able to chew well. And they also have mood disorders that lead to behavior issues, such as removing food from mouth. And I have also read that pocketing mouth is also something common with patients that have dementia. And in stage four, this includes the continuation of language and cognition deterioration, and withdrawal and minimal communication. In this slide, I will be discussing different factors that affect food intake. To begin with, we have some self-feeding difficulties with these patients, and they typically struggle with recognizing and utilizing eating utensils. And these patients are often in care facilities or being taken care of by family. And dysphagia and aspiration are symptoms often present, and seeking help from a registered dietitian and a speech therapist may be needed for some modified diets in these instances. And as discussed in the previous slide as well, where the patients are often being taken care of other individuals, this may also cause some sort of psychological effects on their mental health and can cause some anxiety with eating. And so that's something to keep in mind as well. And going on to the psychological impact of this is that patients suffering with dementia, they often experience confusion and agitation towards the end of the day. So there could be some methods where we plan around that schedule just to ensure that we are giving them the most foods during maybe earlier in the day just because of these symptoms that occur in the end of the day. And so we also have some personality changes that vary among each individual with dementia. They have a lack of interest in food, and they also experience appetite changes and sleep disturbances. In continuation to factors affecting food intake, malnutrition is something that is very common among dementia patients, and it's defined as a chronic state of nutrition that involves either undernutrition or overnutrition with or without inflammatory activity. And there's a certain criteria that signifies that the patient is at risk for developing malnutrition, and this includes chronic disease, involuntary weight loss or gain of 10 pounds within the last 6 months, and involuntary weight loss or gain of 10% or more of usual body weight within 6 months, or 5% or more in 1 month. Also, it includes inadequate oral intake, NPO for more than 7 days, and increased metabolic requirements. And due to difficulties in eating, these patients are at high risk for meeting the criteria of a malnutrition diagnosis. Another factor is dehydration, and dehydration occurs frequently in dementia patients due to them forgetting to drink fluids consistently. This may lead to lower cognitive function because lower hydration status has been found to be related to decreased attention and processing speed. Patients with dementia need to be consistently reminded to drink fluids. Providing a straw may also help with this task.
There are some existing strategies to address nutrition-related problems in dementia patients. Currently, in research, there are a few strategies in place to assist patients with dementia and their nutrition. These include nutritional supplements, behavior-based eating programs, the inclusion of nutrient-dense specific foods into their diet and daily meals, and training of the family and caretakers. All of these steps are good, but some families still find it difficult to keep their loved one at a consistent weight and healthy. Some of the families have come up with their own ways to support their loved one, and these include eating together and socializing over meals, ensuring plenty of time to eat, cutting food into small bites, or using finger foods. They also keep the same routine around mealtimes and minimize distractions. The cognitive decline of dementia patients leads to weight loss, malnutrition, and eating difficulties. Some research suggests that some additions of supplements and limiting of certain foods may help. One article stated that diets lower in saturated fat and cholesterol are associated with decreased rates of dementia. Another research article showed that antioxidants may be protective against developing dementia, as the oxidative stress is linked to neural death and cognitive decline. A similar article suggested that supplementing of B vitamins and folate is linked with lower risks of developing dementia by reducing serum homocysteine levels, which also leads to cognitive decline. The most recent 2 human trials were conducted, and they saw that if energy restriction or carbohydrate manipulation was used to lower energy intake, this was effective for cognitive function. They found that with a low-energy ketogenic diet given over 6 weeks showed an improved verbal memory in older adults with mild cognitive impairment.
The root cause of Alzheimer's disease is currently unknown. However, there are risk factors that have shown to contribute to the development of this disease. As previously stated, there are dietary influences that may promote the prevalence. In 2010, a study published in the International Journal of Alzheimer's Disease identified nutrition as a lifestyle factor that could help prevent Alzheimer's disease. During the Chicago Health and Age Project, a group of 3,700 elderly participants, which included a range of racial and educational backgrounds, gender, and risk factors such as cardiovascular disease, were studied over the course of 6 years. At the end of the study, those who had consumed a diet high in fruit and vegetables and fish displayed a lower rate of cognitive decline, which is important for reducing the risk of developing Alzheimer's disease. 5 years later, a study published in the National Institute for Health suggests that the Mediterranean diet may help reduce the risk of Alzheimer's disease. In a 2-year clinical trial, which consisted of 1,260 participants from ages 60 through 77, the participants that received nutrition counseling and consumed foods that were found in the Mediterranean diet, such as fresh fruits and vegetables, nuts, legumes, and fish, showed a 25% decrease risk of developing Alzheimer's disease. And it is also important to mention that the participants that received nutrition counseling also engaged in physical activity and cognitive exercises. The Mediterranean diet is encouraged as a form of nutrition intervention as it is high in omega-3 fatty acids, antioxidants, B vitamins, and vitamins C and E, folate, flavonoids, and keratins. And these micronutrients have been associated with a decreased risk of cognitive decline in Alzheimer's disease in observational studies. In a study conducted at Duke University Medical Center, the APOE genotype was mentioned as having a direct link to Alzheimer's disease. Individuals with this genotype have a higher risk of developing Alzheimer's disease. This is a non-modifiable factor, but nutritional interventions can be implemented in order to reduce the risk. Another notable mention is the Western diet. This study suggests that Alzheimer's disease is found more prevalent in Western countries, which could be due to the lack of protective nutritional components found in the Mediterranean diet that are not found commonly in the Western diet. This was shown among 2 groups of mice that were studied over 39 weeks. The mice that were given the Western diet showed a decrease in brain function compared to those who had received the Mediterranean diet. The mice that followed the Western diet also had an increased LDL cholesterol levels, which can lead to cardiovascular disease and other health issues. It is important to note that there is no cure for Alzheimer's disease, and we have not found a conclusive preventative measure. Recent studies have found to help reduce that risk, especially in those who have this APOE genotype. In all 3 studies, evidence has shown that the foods found in the Mediterranean diet are associated with the decreased risk of developing Alzheimer's disease.
Since 2017, there are some countries who no longer allow the use of tube feeding because of the lack of usefulness that it provides to their dementia patients. It's important to discuss the use of tube feeding with dementia patients before conditions worsen, just so that they know and understand what situations they're getting themselves into. A research study took place in Israel that included client observations at Zion Medical Center in Haifa, Israel. Guardians of dementia patients never really talked about the problems that individual patient would have at the end of their life. And so they assume that tube feeding is great technology, it'll help save the patient's life and avoid euthanasia. A lot of the guardians' choices were based on religious beliefs and the patient's survival situation. Tube feeding tends to be chosen as a solution for getting dementia patients the nutrients they need to survive, but actually that is not the case, and research has proven the opposite. A research study in 2020 included the use of registered dietitians and their choice of using feeding tubes in Alzheimer's disease patients. Not only are feeding tubes useless in providing the right nutrients to the patients, it also reduces the patient's quality of life. And according to this study, almost 3/4 of registered dietitians agreed that feeding tubes aren't actually recommended. These people provided actual evidence-based responses on the reasoning of turning down feeding tubes, whereas the minority group based the reasonings on religious beliefs and personal beliefs. Even with the amount of new research on feeding tubes, they're still being used to this day.
Incorporating the Mediterranean diet into everyday meals. The Chicago Health and Age Project had a cohort study of over 3,700 participants. What was found was a high vegetable consumption was associated with a slower rate of cognitive decline in over a 6-year time period. In this study, the consumption of green leafy vegetables that were rich in antioxidants and micronutrients showed a strong inverse linear association with the rate of cognitive decline. Antioxidants and Mediterranean diet provide evidence that nutritional intervention against dementia and AD have a great potential of influencing dementia development. So foods like vegetables, fresh fruit, whole grains, beans, chicken, and fish are all beneficial foods that we can incorporate into everyday meals to give dementia patients a diet that adheres to a Mediterranean diet. Some additional tips to help improve nutritional intake of dementia patients. Provide smaller and more frequent meals. There's going to be a eventual lack of hunger as well as a likelihood to refuse food as they do not feel hungry. So having smaller, more frequent meals can help get that calorie intake as well as using some high calorie options. Ensure easy access to beverages as well as having snacks in easy to see places. It's also important to have options for plates and mugs that are solid primary colors. If you have a pattern plate or a plate with a lot of different textures, this can distract the dementia patients from the food when the food is going to be the main task at hand. And also, it's important to be aware of the changes of taste and preferences. So with dementia, taste buds tend to diminish and deteriorate. So what their favorite foods might have been might have changed. So it's also good to give them foods that are very high in flavor, usually very sweet or very salty, so they can really taste and enjoy the food. Cognitive issues often affect one's ability to feed themselves. Through encouraging independence during mealtime, the nutrition issue can decrease. By providing a proper environment, like providing plates and utensils designed for dementia patients, one can successfully eat a meal independently. Visual issues can cause patients not to see items on the table, so using red plates can highlight the contrast between the food and the table setting, allowing patients to recognize the food. Dehydration goes hand in hand with food intake. Often the same reason why a dementia patient might struggle to eat affects their drinking. Fluid intake is important to maintain proper lubrication between joints, control body temperature, and maintain heart rate. A new product was released on the market in 2020 to address the issue of dehydration in dementia patients. Jelly drops were created by Louis Hornby, who witnessed his grandmother struggle with severe dehydration with dementia. The jelly drops are a bright color and they're meant to be eye-catching when they're packed in a tray to look like a box of treats. The jellies were also designed to be easy to hold for the dementia patients.
Future research. Individuals and families are able to contribute to the shift of decreasing dementia by addressing the syndrome to prevent negative outcomes in the future. Recommendations to give to individuals and families about addressing the topic include focusing on palliative care and routine assessments. Dementia patients have been shown to require palliative care as extensive as cancer patients, but these advanced dementia patients are not being routinely assessed to receive this care. Palliative care frameworks have the ability to improve the care that dementia patients and their families may receive. Changes led from researchers, funders, and policymakers for adequate support to those affected. Our team proposes to address the problem and reach people affected by it by investing in future research for further knowledge of risk, protective factors, and disease course. Future research of solid evidence that is not constrained to a single population is critical. Interpreting palliative care into practice for dementia after solid evidence is collected. Built from research priorities, new resources should have a minimum data set for a cross-study in testing intervention and prevention strategies. Expanding research to include different populations for research to allow generalization. In other words, prevention strategies should be based for population treatment and backed up by global monitoring.
In conclusion, while dementia is a difficult diagnosis, patients can be hopeful that the research currently being done may help improve their nutritional status. More training with caretakers and family about ways to promote a healthy eating plan, sticking to specific foods, implementing supplements, and having a routine set around meal times are shown to be helpful. Small changes like the color of plates and placemats, adaptive utensils, and cutting food into bite-sized pieces are also beneficial. Using alternative feeding methods such as tube feeding is not recommended as it does not seem to improve their nutrition. The Mediterranean diet has promising research as it helps slow the rate of cognitive decline. Thank you for watching our presentation about dementia patients' nutrition.